Headlines tonight for its promising success in treating kidney disease. This is according to a new study published in the New England Journal of Medicine today. And it found weekly injections of semaglutide drugs like Ozempic could slash the risk of kidney failure and death by 20% for those with type 2 diabetes and chronic kidney disease. This study was funded by Novo Nordisk, which makes Ozempic. It's now asking the FDA to expand the drug's use to include chronic kidney disease. And more than 35 million Americans are living with kidney disease. This follows a report last week that found patients who had been taking Ozempic or its sister drug Wegovy for weight loss successfully kept the pounds off after 4 years, and they had a reduced risk of heart disease. But questions remain, largely because it is so relatively new. It was approved for medical use in this country just 7 years ago. Joining us now with more is Dr. Sue Decotiis, who specializes in weight loss and hormone therapy. Doctor, we appreciate your time, and tell us why this study is such a big deal, because it seems kidney disease is very common for people with diabetes. About 1 in 3 people with diabetes impacted by kidney disease. Could this be life-changing for millions of people?
Yes, this could really be life-changing. I mean, kidney disease is one of the worst things that anyone can have. It's very progressive, especially in a diabetic. And usually within a couple of years, someone can wind up either on dialysis or needing a kidney transplant. And once someone goes on dialysis, their risk of cardiovascular disease goes up like 50%. There's a very, very high chance they're going to die of a heart attack or stroke. So they're losing weight, they're controlling their diabetes. And I think by virtue of the fact that we are regulating the way insulin works, and insulin is a hormone, that really helps improve kidney function by increasing blood flow to the kidney. So it's really never been a better time to be in weight loss medicine. It's such a fantastic time because we're really able to help patients like never before.
Certainly in my lifetime, I've never quite seen a medication like this that has so many, it seems like magic bullet applications. And I do want to ask, Novo Nordisk did fund this trial. They obviously have a lot to gain with these results every time this expands to another issue. Should we have any questions about the objectivity, the way that this trial was conducted?
I don't believe so. I mean, I think they want to do well, and they know they have a great drug. And a previous study about a year ago also showed the same thing. And I'm really not concerned about too many long-term sequelae. I practice in Manhattan. I see a wide range of patients in the tri-state area and all over the country. And I've really never had anybody have some of these horrible side effects, like pancreatitis or thyroid cancer or anything like this. The GI side effects are usually pretty minimal. But I will say this, as far as treatment goes, I think sometimes we're missing the boat about not emphasizing how important it is, as if a patient is losing weight, that we really monitor their body composition. We have to be sure that they're losing fat and not muscle. A patient that loses muscle is going to be at increased risk for many different problems. They're really kind of going to waste away. They're not going to be healthy. And one way to prevent muscle wasting is hydration. And that's often something that patients are not being told to do. So in my practice, if any of my patients are watching, I'm sure they're rolling their eyes right now. I'm always telling them, drink a tremendous amount of water, especially on the highest doses. And that also goes for those patients that are taking Mounjaro or Zepbound, which is tirzepatide, not just semaglutide, which is Ozempic or Wegovy. So that's really, really important.
That's really interesting, and I'm glad you bring this up. So if someone were not to be on a semaglutide, when they lose weight, the muscle wasting is something that we really see with semaglutides that we wouldn't see normally with just normal drastic weight loss. Is that right? It's increased.
Well, it can happen with both. So what happens is the body burns fat. As the body is burning fat on these drugs, and that's what these drugs make you do, because insulin, when you turn insulin on, insulin is your major fat-burning hormone. And the reason why so many people are obese is because insulin is not working. There could be genetic factors, there could be stresses, there could be underlying problems, other endocrine problems. But we know that it's really important for insulin to work. However, insulin is not going to work as well. The body's going to shut the whole drug down if it feels you're losing too much water, because the fat cell is mostly water. So when you're burning fat cells, you're losing water. So what does the body do? Because you're in calorie deficit, because these drugs make you really feel full. You're not going to be eating very much. So what will happen is, by default, they're going to switch to burning muscle. But that's not going to happen if the patient is hydrating. So in my practice in New York City, I've really never seen anyone waste away. We're able to maintain muscle mass or increase it. And this is for patients in their 70s and 80s.
Okay.
I really think
so hydration is the key. We're almost out of time, so I don't mean to cut you off, but I want to make sure to ask you this, because semaglutides, as we've been saying, really came into the public consciousness in such a big way in such a short amount of time. And there's so many Americans who are already taking it or who are interested in taking it. And we're talking about things totally beyond diabetes and obesity. Early results showing it helps the heart, PCOS, fatty liver disease. That's a quarter of Americans right there. And now we see the kidneys, even I think psoriasis I saw. Are we moving in a direction where you think most Americans will be eligible for this medication? And would you support most Americans being on it eventually?
Yes, I really would. And I think there are other drugs in the pipeline that are going to wind up being a lot cheaper. And realize this, these drugs are part of a category called peptides, which are really pretty incredible, which are basically simple strands of amino acids that are put together to perform certain functions. And their safety profile is very high. So there are many other peptides that can be used as well. So I think this whole category of drug is going to explode. And yes, I would like to see more patients on these GLP-1 drugs.
Okay. Dr. Sue Decotiis, I appreciate your time. Thank you so much.
Thank you so much.